Hello guys, welcome to my YouTube channel. Let's join pharmacy. Yes, today in this lecture, let's discuss about the important topic in GPAT of pharmacology. That is of a general pharmacology. While reading pharmacology, you should know this basic concept of pharmacology. 2 to 3 questions every year they will ask from general pharmacology only. Okay, on the basis of the pharmacokinetic, on the basis of pharmacodynamic, and sometimes they will ask from the distribution, and sometimes they will ask from the bioequivalence. Okay, and sometimes they will ask from the your bioavailability. So 1 or 2 questions, minimum one, maximum 2 questions are fixed from this general pharmacology. So it is very important to understand you all general pharmacology. And in pharmacology you will get approximately 28 questions in your GPAT. So in that 28 questions, you get 2 questions from this general pharmacology, means you are remaining 26 questions. Now let's discuss the concept of general pharmacology, and this is the part 1 of the general pharmacology. Let's discuss in next video. We will discuss about the part 2. Okay, so pharmacology, you know, that is the science dealing with the drugs. It is divided into several branches like pharmacokinetic, dynamic, pharmacotherapeutics, chemotherapy and toxicology. Clear? Okay, pharmacology, it is one of the branch of science that deals with the drugs, that divides into several branches like kinetic, that is pharmacokinetic, pharmacodynamic, pharmacotherapeutics, then chemotherapy, and at last toxicology, toxicity of the drug. Next is drug administered by various routes. This is also one of the very important topic. See, you have gone through various routes of drug administration. Here one is sublingual. In that sublingual, let's discuss some of the examples. Nitroglycerin. Okay, nitroglycerin, it is given to treat some of the heart problems. Sublingual means down to your tongue, lingual cavity, down to your tongue, that is a sublingual. And isosorbitrate dinitrate, clonidine, nifedipine, this you have to understand. Very important point. These all are, means these examples for the sublingual. Sometimes they will ask among the following which is the example for sublingual. This time also they can ask, this pattern also they will ask. Transdermal nitroglycerin, it is also comes under the transdermal. Transdermal means, I will tell you, nicotine, fentanyl and hyoscine. See here, transdermal means what? Transparent layer where on your dermal cavity. Dermal cavity means skin. Now see, you have observed that handiplast we are using, hansaplast. That hansaplast used on our dermal cavity, that is of transdermal. Okay, today in modern generation, transdermal type of the drug administration, means route of administration, is very favorable. Because this transdermal, what it will do, it will supply the drug slowly, simultaneously, for that way. Then nasal example is nephrelin, calcitonin, then desmopressin. Clear? These are the very important. Nasal cavity. Next one is a sublingual route avoids first pass metabolism. These points are very important. Okay, sublingual route avoids first pass metabolism, can be used in the emergencies. See, sublingual, they avoid the first pass metabolism. No, what do you mean by first pass metabolism? These basic things you have to understand. See, first pass metabolism means here what? Metabolism, you know, all know that metabolism will occurs in the liver only. But here in first pass metabolism, they will bypass the first pass metabolism. Means these sublingual drugs or IV drugs, what they will do, they won't caught into the first pass metabolism. Directly they enters into the blood circulation. So you know that if before reaching to the blood circulation, the drug has to complete the first pass metabolism. Here sublingual drugs, they will inhibit or they will boycott the first pass metabolism. They will take bypass from that, cut from the first pass metabolism, directly they will reach to the which cavity, which circulation, blood circulation. Clear? Then directly the drug acts on the particular affected site. And transdermal route is used only for the drugs which are highly lipid soluble. Okay, those drugs which are highly lipid soluble, because see, this is the membrane. That membrane should cross the barriers. Which barriers? Lipid barriers. You know that many lipid barriers are present here. Okay, that lipid barriers, if the drug is lipid soluble, then only it can pass. Otherwise it is very difficult to pass the lipid barrier. So that's why only lipid soluble drugs are used in the transdermal route. The next point is rectal route avoids first pass metabolism. You know that rectal route to 50% extent. Okay, diazepam is given by this route in children for febrile seizures. Now, what is this febrile seizures? We will discuss. See, rectal route also, it is one of the very important route, mostly preferred in the children's and in the old age patients. See here, rectal route here, what it will do, it will also avoid the first pass metabolism, but for certain extent, for 50% it will avoid. Now one point you have to remember here. See, rectal route means you all know that, okay, from the backside route or anal route. Okay, example is suppositories. One of the best example, suppositories. Dulcoflex suppositories you are using in the children or in the old age to prevent the constipation problem. Yes. See, diazepam is given by this route in children for febrile seizures, means convulsion in children due to fever convulsion. These are known as febrile seizures. Next, our first beginning of this general pharmacology, then pharmacokinetics. You know that in pharmacokinetics there is absorption, distribution, metabolism and excretion. That is also known as ADME. In this lesson we will first, in this unit 1, let's discuss about this absorption topic. Okay, you will get these notes in the description. Download these notes, very important notes for you for your GPAT exam. You prepare, you read these notes, because I have made a very short, collected very important points here. After completion of the unit, this general pharmacology, we will go through the MCQs on this unit. After that we can discuss about the another unit, like on the hypertensive drugs. Okay, other. Then the first one is absorption. See, weak electrolytes, unionized form, they are lipid soluble. Clear? Weak electrolytes means electrolytes, the drug in which they are weak in nature, so they are unionized form. That unionized form is a lipid soluble. See, you remember one thing, if the drug has to show the action, means that should be unionized form. Ionized form drugs are not accepted by our body. Why sir? Why ionized form is not accepted? Means, see here, because our body has many different types of the layers. Okay, majority here of our body contains lipid soluble layers. So for that reason, weak electrolytes, if they are unionized in form, then that is lipid soluble. If lipid soluble, bioavailability is more. If bioavailability is more, then the effect of drug on a particular site is more. Understand one point, unionized form is very important. Unionized form, that leads to the lipid soluble. Next, ionized form, water soluble. If the drug is water soluble, then those are ionized form. Which one? Ionized form. Next, when medium is same, drugs can cross the membrane. This is also one of the very important point. Now what's the meaning of this? See, when medium is same, drugs can cross the membrane. I will tell you one good example. Here, acidic drugs can cross the membranes in acidic medium. You see, some of the drugs are acidic in nature, some of the drugs are basic in nature. Okay, and now these acidic drugs, they can cross the membrane. Which membrane? Acidic medium membrane. Acidic medium, for an example, see, stomach is the region where it constitutes many of the acidic solutions, like HCl is one of the major here. Here which medium we are telling? Acidic medium. If acidic drugs can cross the membrane in acidic medium, then it is means there is a more solubility, lipid soluble, unionized form, more bioavailability. So that's why they are telling, when medium is same, drugs can cross the membrane. Medium means that should be acid resistance. Acid resistance. See, acidic drugs can cross the membrane in acidic medium. Those drugs which are acidic in nature, they can cross the membrane. Where? In acidic medium only. If the acidic drugs, they are settled in the basic medium, they cannot. Acidic acts in acidic medium. Acidic drugs are unionized, then they are lipid soluble. Simple. Acidic drugs, if you passed in the acidic medium, then they will get unionized and they will lipid soluble. As gastric pH is acidic, gastric pH is acidic, that is, acidic drugs are more likely to be absorbed from the stomach only. Okay, some drugs which are acidic in nature, so they will directly get absorbed where? In the stomach only. No need to go for intestine villi. They will directly absorb into the stomach only. Why? Because these are acidic in nature. Hence, aspirin is more likely to be absorbed in the stomach than morphine or atropine, basic drugs. So, for that reason, if we give a patient aspirin, morphine, atropine, so this aspirin get absorbed immediately in the stomach because of its acidic character. Morphine and atropine, because of their basic character, they will not absorb in the stomach, because morphine and atropine, these are the basic drugs. Aspirin, it is the acidic drug. There is never 100% lipid or water solubility. This point is also very important. Okay, there is never 100% lipid or water solubility. And acidic drugs having pKa 5 and pH 5, so it will be 50% ionized and 50% unionized. One point you remember, pKa and pH, these are very important in absorption. If your pKa is 5, pH is also 5, then the drug, 50% drug is in ionized form and 50% drug is in unionized form, equal sharing. Next point, if it is present in a medium with pH 4, means the same drug, it is having the pKa of 5 and pH is 4. Now this pH is less than that pKa 5, means what happens? Your drug is lipid soluble. Now, some of the weak acids are there. This you have to remember, weak acids, that is barbiturates. In that barbiturates, phenobarbital, some of the NSAID like aspirin, these are the weak acids. Diclofenac, methotrexate, sulfonamides, penicillins. Then weak bases like morphine, atropine, then amphetamines, quinine, hyoscine, these all are the weak bases. You have to remember this. Among the following, which of the following is weak base? They will ask like this way. Among the following, which drug will absorb in the stomach immediately? This type they will ask. Remember, acidic drugs will be absorbed in acidic medium. Basic drug will be absorbed in basic medium. If the pH of the medium is more than pKa, pH is more, then medium becomes alkaline. pH, that for an example, you take pH 7, okay, 7. Now pH you take 5. Now pKa value you take 4. If the pH is more than the pKa value, means then the medium is alkaline, basic in nature. Ionized and unionized depends on difference between the pH and pKa. Clear? If ionized and unionized, where they will depend? They will depend on the pH and pKa. I have told you, if the pKa is less than pH, if the pKa that is less than pH, then that is ionized form. Okay, if pH is greater than pKa, if pH is less than pKa, then it is unionized form. If both pH and pK equal, then they are 50% ionized and 50% unionized. Then bioavailability. What is this bioavailability? It is the fraction of the administered drug that reaches the systemic circulation in unchanged form. Now you have to take the paracetamol 650. Now that paracetamol 650, okay, that paracetamol 650 reaches the systemic circulation in unchanged form. 650 mg, directly 650 mg, it should be reached to the where? In your blood circulation. So that is bioavailability. How much drug is available? Bioavailability of IV route is 100%. See, bioavailability of why IV route is 100% means IV route. See, this IV route, that is intravenous route, directly we are giving into the veins. From that veins, the drug is directly where it is circulated in the your blood channels or in the circulatory system. So IV route, it is bioavailability of that IV route is 100%. If bioavailability is more, the action of the drug towards the particular effect is more. Okay. Example, diclofenac tablet and diclofenac injection. This diclofenac injection having 100% bioavailability means good action for the pain. But diclofenac, it is also a painkiller, but that diclofenac, its bioavailability is less when compared to injections. Okay, why means because I have told you bioavailability means what? The amount of drug that reach to the blood circulation or that reach to the systemic circulation in an unchanged form. Now see, if you are given diclofenac tablet means there may be chance of some changes because of the first pass metabolism. First it has to cross the stomach membranes, then intestine membranes, from that intestine to villi, from that villi it passes to the liver. In that liver there is a first pass metabolism, second pass metabolism, after that it goes to the blood circulation. Huge process. But in this IV routes, no, directly into the veins, from veins to systemic circulation. So there is no first pass metabolism, means they will bypass the first pass metabolism. Now drugs with high first pass metabolism, those drugs which are high first pass metabolism, very important. See, there is one trick. Nitrates have large pre-systemic metabolism. Nitrates have large pre-systemic metabolism. Now nitrates have means H hydrocortisone, large lignocaine, pre-propranolol antidiuretic, then systemic, which one? Systemic, that is salbutamol, metabolism morphine. Clear? Morphine. Sorry, this propranolol, it is not a antidiuretic, it is a diuretic drug. Diuretic, which excretes the urine. Okay, and also this propranolol act as a antihypertensive drug. Antihypertensive drug. Next, our topic is distribution. That we will discuss in the next class. Thank you.